There we go. Share where you're from. Post your questions in the chat. Share your comments. If you're on Facebook, share where you're from, right? We want to learn more about you. Post your name. We want to engage with you. Definitely get ready to post your questions. Our speakers are here today to really answer your questions. So definitely do that. So what I'm going to do is I'm going to introduce our amazing speakers tonight. These women are absolutely phenomenal. They are going to help us really process through what is the state of mental health in Tampa Bay and around the country, and what are some ways we can really address what's going on. So I want to first introduce Diana Andre. She is the founder of Expressions Therapy Center. She offers a space that is calming and nurtures her clients' creativity. She's a credentialed licensed mental health counselor in the state of Florida and New Jersey. Her educational background includes a master's degree in clinical and mental health counseling from Troy University and bachelor's of sociology from the University of South Florida. So welcome, Diana. I also want to introduce Representative Fentress Driscoll. She was elected to the Florida House in November of 2018. Her approach of bringing common sense solutions to our state's most pressing challenges allowed her to defeat an incumbent and bring more accessible, passionate representation to District 63, which includes parts of Carrollwood, Lutz, the University of South Florida, and New Tampa. Aside from her service as a state representative, Representative Driscoll is an AV preeminent rated attorney who currently practices law at Carlton Fields in Tampa, Florida. Please welcome Representative Fentress Driscoll. Dr. Shamika Jones is a regional clinical pharmacist at Florida Blue. Her pharmacy career spans over 18 years with experience in retail, hospital, and managed care pharmacy. She is a distinguished leader with uncompromising commitment to public service. She is devoted to her community and is passionate about helping others achieve excellence. Dr. Jones has served in leadership capacities with many organizations and boards over the past 25 years. Please welcome Dr. Shamika Jones. Dr. Sharon Brown is a wellness advocate who cares about helping communities advance health equity for individual and community well-being. She is the executive director at the Tampa Bay Healthcare Collaborative, a wellness coach, and she is passionate about helping people get clear about their identity within systems and understanding how to leverage their identity individually and collectively to embrace their personal and collective power to bring about transformation. Please welcome Dr. Sharon Brown. And last but certainly not least, Angie Speller is a licensed mental health counselor and board certified counselor. She received her Master's of Arts from the prestigious Rollins College in Winter Park, Florida, after graduating from the University of Florida with a Bachelor's of Science. Aside from her training in mental health counseling, Angie received specialized training in dream interpretation, mindfulness, meditation, and hypnosis. Her experience in the substance abuse treatment field as a clinical director for over 5 years and 11 years of additional experience in the field indicates her dedication to recovery population and community. Please welcome Angie Speller. If we can just give our amazing panelists and our moderator a round of applause. I know you all are like, yay, yay, yay. We are so excited to have these amazing thought leaders and community leaders who are passionate about this topic really share wisdom with us tonight. So I want to remind you, post your questions in the chat, share your comments, share the live event with your community, have a little virtual watch party. So before we get started, I want to first ask the audience a question, because this conversation is about mental health. So if you want to post in the chat, whether you're on Facebook or if you are on YouTube, do you have a therapist? And on a scale of 1 to 5, what has the experience been like for you? So let's start the conversation. Share Facebook, on YouTube. I'm actually going to pass the invisible mic over to Diana Andre, who will be moderating the panel. Thank you all so much for joining us tonight. And Diana, you are on mute, just FYI. No problem.
Thank you. Yeah, I forgot I put myself on mute.
No problem.
But thank you for the introduction. I just really want to say it's awesome to be here tonight with you ladies. And I'm really excited to be part of this very important conversation. So So tonight we're here today to focus on the mental health outcomes of the Black community. So let's talk a little bit about the numbers. According to the Health and Human Services Office of Minority Health, Black adults in the US are more likely than white adults to report persistent symptoms of emotional distress, such as sadness, hopelessness, and feeling like everything is an effort. Black adults living below the poverty level line are more than twice as likely to report serious psychological distress than those living above it. So, despite the needs, only 1 in 3 Black or African American adults who need mental health services or care actually receives it. According to the American Psychiatric Association's Mental Health Facts for African Americans guide, African Americans are less likely to receive guideline consistent care, less frequently included in the research that are done, and we're more likely to receive emergency rooms or primary care. Well, excuse me, we're more likely to use emergency rooms or primary care rather than going to see a mental health specialist. Okay, and according to NAMI, some of the barriers that we have faced in the Black community for our mental health care are stigmas, the distrust of the healthcare system, lack of diverse providers, lack of culturally competent providers, and lack of insurance or being underinsured. So, and interestingly enough, according to the American Psychological Association, we there are about maybe 2 to 4% of therapists that are Black. Something's happening. Okay, sorry, my screen is flashing. Sorry about that. Okay, so let's look at some of the struggles that we actually face in the Black community when it comes to our mental health. One of the things that we face are cultural implications. We are taught that mental health problems can be addressed through religion or faith practices. You know, typically, if we have an issue, we're told to pray about it, or let's focus on Jesus, or let's focus on God, and you don't need to talk to a specialist. We also experience racism. And slavery has deeply shaped or impacted and contributed to the mental health disparities in the US. There's also a general, here it is. I'm sorry, can you guys hear me? Okay, sorry, my screen, technical difficulties. Okay. We also have a generational mindset where we have normalized that seeking therapy or seeking to speak to a psychiatrist or psychotherapist is a luxury rather than a necessity. And there's also a lack of education. There is a need for more education about the benefits of psychotherapy and the long-term consequences of not seeking help. So as you guys well know, I am a licensed mental health therapist, and I do practice. I see children as early as 3 years old, all the way up, teens and adults. And the unique thing that happened, well, with the racial justice situation that's happening right now, and with everything that's happening right now, one of the things that have occurred is an increase in me seeing more Black clients. And the one conversation that I do have with them is that this is the first time that they come into therapy. And one of the reasons that they don't come into therapy is because they don't see any type of representation of them, and they don't feel as if their concerns or their issues will actually be addressed, because maybe, because everyone is not a person of color, what we see as therapists, we're not as prevalent to go to them and talk to them about our deepest secrets. So it's almost a sense of relief that, you know, when they come into the office, that I am Black and I understand their struggles, or at least they feel as though I can relate to some of their issues. So those are, you know, that is an interesting thing that that I found all across the board of my African American clients that are experiencing therapy for the first time, or maybe they're coming in the second or third time, trying it again, but this time with a Black therapist. All right, so I am going to bring on some of our other panelists so that we can get right into the big picture, right into our discussion question. So we're first going to speak with Representative Fentress.
Hi.
So, hello. So according to Mental Health America, states have significant power in making decisions about their mental health systems. So mental health regulations and available services can look very different from state to state and even from county to county. What gaps in mental health resources are you seeing from a systems level perspective?
Well, good evening. And first, I'd just like to thank Tammy and Tampa Bay Spark for holding this very important conversation. And especially with so much going on in the world right now, I think it is a particularly timely conversation. So in Florida, there's no real community-based mental health network for people, for our citizens. And so that's a real issue, because then accessibility becomes a concern and cost becomes a concern. Medicaid does cover mental health services, and Medicaid is administered by the states. You know, the states pay taxes that go up to the federal government, and then we get those back in the form of grants, block grants. Florida is what is considered a donor state, meaning that we pay more in the system than what we draw down. So because we don't adequately fund Medicaid, we have reimbursement rates that tend to be very low and that don't always meet with what is expected or expected by healthcare professionals who would certainly like to be compensated for their skill and their expertise. And so we don't fund it like we should. The rates are too low. And then what about families and individuals who don't qualify for Medicaid? What are they supposed to do? So I think looking at building out the infrastructure for a real community-based mental and behavioral health network for people in Florida would be a great step in the right direction. And just to really bring this home, I was referencing the times that we are in right now with the COVID-19 pandemic. We know that this is impacting communities of color, and particularly Black people, to greater extent, right? There's a health disparity there. And we look at the physical effects of it, and we look at our community with underlying health conditions. But there's also going to be fallout from this, I think, in terms of mental health and behavioral health. And so it's time for us to start talking about those stressors as well. I had many constituents call me with challenges that they're having with unemployment benefits and economic hardship during the pandemic. And recently I got contacted by a Black female constituent who was really going through. She lost her job last month. She hadn't been able to get her unemployment claims paid. She didn't know how to provide for her family. And so she was at the brink of suicide. She was feeling depressed. She was feeling suicidal. And so this literally, it's mission critical. We literally are putting families in the position of, okay, I don't even have money to put food on the table. How could they even think about having a counselor? So it's, and thinking between those decisions of putting food on the table versus protecting their health. So, I think there's a lot of work to be done, but building out a community-based network might be a good start.
Thank you. Those are all some really great points, Representative Fentress. Thank you so much. So can I ask you a follow-up question? What role does the public sector play in engaging this issue of access and affordability to mental health resources in the Black community?
So I think that awareness actually is a really big part of this, and pushing for the policy and legislative changes from the ground up, because then that helps people like me who serve in the legislature to be able to say, this is something that my community needs and wants. I mean, we do all that we can, and there certainly has been some good legislation that had been introduced and passed recently. Senator Darrell Roussan, who represents parts of Tampa and parts of Pinellas County, worked on legislation last session and that redefines mental illness related to the Baker Act and things like that. And it creates a first responder suicide deterrent task force, which is a really good thing. But, it certainly helps us to have the support of the public, but then allows us to be more effective as legislators. Then I would also say it's important in order to get to that tipping point of awareness in the community for us to talk about how this affects us, how it impacts us. So one of the other areas of concern I wanted to raise was with respect to maternal mortality. And we know that there are health disparities there, both for Black moms who die at a higher rate in childbirth or from complications from childbirth than white women. And we know that Black babies die at a higher rate than white babies. And so part of what I'm coming to understand might be a factor in this disparity is something called the wuthering effect. When you consider all of the environmental stressors that Black moms and Black families have to deal with on a daily basis, even when considering their unborn children, right? Like what's going to happen when that baby grows up? What's going to happen when they're out in the world? Will somebody perceive their melanin or their skin color as a threat? There's so many stressors that we deal with, and it has real world impact. So I think understanding as well the way that stress and mental health and behavioral health issues impact us can go a long way in impacting that tipping point.
Yeah, those are some really scary numbers. So let me ask you, how can we reimagine progress for the Black community as it relates to mental health?
I think once we start seeing some of those disparities close, once we start seeing success in the numbers, we know we would have achieved it. And, like you mentioned, those numbers are scary. It used to be that Black babies in Hillsborough County were 5 times more likely than white babies to die. Due to the work and efforts of women like Lo Berry and Federal Head Start and some other really great programs here in the county, that number has been reduced to 3 times. But to me, that's any factor is a factor too great, right? Like we don't want any of the babies dying or the moms dying at a higher rate. So, it's a real issue, and we have to start trying to build out better support for people in our community. And I think when we see some of these numbers go down, we see some of the stigma decrease, then we'll know we've had some success.
Awesome. Thank you so much for your input, Representative Fentress. I'm sure we'll have some questions from our audience, and as soon as we get through those, we'll definitely bring you on to answer more questions. Thank you.
Thank you.
Okay, so Dr. Sharon, and I hope I pronounced your name correctly, Dr. Sharon? Sharon. Sharon. Yes. Sorry about that. Dr. Sharon. Thank you. There are numerous resources that are available in the community to help address mental health care needs. What is TBHC doing to foster collaboration amongst organizations to address gaps in mental health resources in the community and to ensure equitable access?
Well, first of all, I'd like to also say thank you. I'm grateful to have the opportunity to share and be a part of this panel. I want to start by saying that the Tampa Bay Healthcare Collaborative is a member-driven organization that promotes and advances health equity through increasing awareness, building capacity, and fostering collaborations. With regard to fostering collaborations among organizations, we start by first remembering that we serve the people that work within the organizations. I believe that we can sometimes get lost in our conversations when we don't humanize the work by being intentional with our language. So I first wanted to say that although we're talking about organizations, I'm always mindful that we're talking about the people in the organizations. So how do we foster collaboration among people that work in these different organizations? One thing we do is create spaces to help people increase their clarity about best practices in leveraging the strengths and resources of each other's organizations. within the community for greater impact toward achieving the collective goal of enhancing community health. And in this case, we're talking about mental health in the African American community. An example of this is an upcoming collaboration experience that actually was just being organized today by our member-led Collaboration Impact Council. The council has decided to focus on health issues that were prioritized in the 2019 Health Needs Assessment that was conducted throughout the Tampa Bay region by hospitals, with mental health being one of those issues. And so what they intend to do is have the participants, again, the individuals that work in these organizations, leave with the tools, the resources, and the connections that are needed in order to help them enhance collaboration efforts so we can improve mental health outcomes in our African American community in Tampa Bay.
Okay, great. Thank you. Now, how can the organizations eliminate silos and collaborate more effectively to address the mental health care at an ecosystem or systems level?
Mm-hmm. That's good. So I love talking about systems level thinking. I think, excuse me, I think one thing that some may have to do is first acknowledge that silos are real. I've been in various conversations where some think it is real and others think it's not so. The fact is that there are over 10,000 nonprofit organizations in the Tampa Bay area, all working diligently toward their cause. And I would bet that it's probably safe to say that they don't all know each other. Mental health and health equity, for that matter, are tough challenges, and no one person or organization holds the answer that is the silver bullet. Because of that, one of the things we are really honing in on for 2021 as a collaborative is building capacity in using a systems thinking approach to impact social change, helping us understand the possible unintended consequences of our well-intentioned actions, seeing the negative reinforcing loops we may be creating, and finding the most effective leverage points that we can use to correct the obstacles we may be creating in our well-meaning actions. That was really technical, so that's why we're going to do a deep dive on that in 2021. But another way is something that is coming up at the start of the year. We've been working on a digital collaboration space, which now with COVID-19 is so critical because people still need to be able to come together to collaborate. So we've been working on a digital collaboration space that we're going to launch next year to help, again, the people that work in these organizations that are wanting to advance health equity, particularly in the area of mental health, as we're discussing tonight, help them find each other, make connections, and immediately inform each other and the community about the collaboration opportunities and resources. And that's something that's coming up in January. So anyone that's connected to the Tampa Bay Healthcare Collaborative, you'll be informed about when that's available. But until then, we serve as a conduit to help connect organizations for collaboration purposes. So for example, in our community right now, the Community Foundation of Tampa Bay has launched the Mental Health First Aid Initiative with Love for Lawrence, St. Petersburg College, and Humana. And the goal of this training, which I believe it's only about $125. But the goal of this training is to empower 5,000 key personnel in nonprofits, faith-based communities, and other community settings to identify, understand, and respond to signs of addictions and mental illness. That's something that we'll definitely be letting our community know about, and it'll be even easier to communicate once we have that digital collaboration space. But again, that's a resource that's available right now, and they're doing that work. And so just to even go to the Community Foundation of Tampa Bay's website to find out about how to be one of these individuals that are trained, that's action that we can take right now.
Oh, Awesome. Thank you so much, Dr. Sharon. This is some really good information, and I'm actually excited to see what comes with the digital collaborative space.
Yeah, I'm excited about that as well.
And also the mental health first aid. That is really important because we, a lot of time, not a lot of times, we often miss the simple signs, that we know that are simple signs that a lot of us don't know how to identify. So being able to have an initiative that allows, nonprofits to train in that it's really great. So this is awesome.
Absolutely.
So I do have a follow-up question. So as you know, the deeply rooted mental, well, okay. So as you know, in our Black community, a lot of majority of our mental health is deeply rooted in was tied to systemic racism, racial trauma, and even goes as far back, into slavery. Um, and the trauma of that, and Jim Crow, the disenfranchisement, public brutality, and more. So while individual healing is important, where do we start to begin the process of collective healing? And what is the role of the broader community in making this happen? And I think actually that first aid initiative is actually a really good start to that collective healing.
I would agree. And I would have to say that, this is a ginormous question. And by that, I mean, it is gigantically enormous. I'll start by saying that I don't think any of us by ourselves have the answer to that question. I want to preface this by also saying that when there are big life questions that demand answers, such as this one, I like to look to patterns in nature. I believe that the systems in nature hold answers that we can borrow from. So when we're talking about healing, I think of wounds and I ask, how do our wounds heal? How do our bodies heal themselves when they are wounded? Because it is a multifaceted approach, right? So first, you have some cells that are doing the work to stop the bleeding, and then others are stopping are creating clottage. Then some come in to protect the wound, and others fight the infection. Some get into a repair process. Then there are others that release cleansing liquids, and the process goes on. And really, when you get a cut, it lasts for months because it all ends with your tissue rebuilding and growing and strengthening itself. So because I like to look to nature, right, that alone, and I didn't even go into all the details of what it takes to heal a wound, just a flesh wound. We're talking about healing wounds between human beings who have emotions, right, and who have perspectives and who have biases. So what does that all take if we look at what nature shows us? And from my perspective, I would say that I would imagine that what we want to do is bring people together, a diverse group of people that represent multiple sectors and diverse communities, to think through the healing process together using nature's organic systems approach as an example to arrive at a collective response. That would be I think so. That would be an exciting process. And I think it would be a very worthwhile process to identify. And it would be hard work. It would take our time, but I think it would be worth it, in identifying what is the bleeding, everything that spills from the isms and inequities are the bleeding, identifying how we stop the bleeding, how we clot, who clots, what would the cleansing salve look like, who's engaged in applying the salve. You see how many things could be going on here? And that wouldn't just take months as with the flesh wound, that would take years, because after all of that, we still need to agree on what does the growing, the rebuilding, and the strengthening processes look like. On top of that, we'd also need, I think, succession planning as a part of the process. We'd need to look at what young leaders we need to identify using an asset-based community development approach to continue the work while we ensure the same thing happens for each generation. This is big, painful work, and it would take a tremendous commitment of time and heart to engage in taking it on. So that was a lot, but I will say this very simple thing. Collective healing begins with individual healing. I believe that all of us have our inner work to identify and face with regard to what level of healing we all need to do for ourselves before jumping out there and proclaiming that we want to heal the community. I believe that pain begets pain. And so if we're carrying any unrecognized, individualized pain, we would not want to bring that to our collective work. So from my perspective, I would say that the very first thing, but the not so simple thing that we need to do is to search inside ourselves first, to do our inner work, to heal our own wounds. I can't help but just go to Matthew 7, where we're encouraged to first remove the log out of our own eye so that we can see clearly before trying to remove the speck from our brothers and our sisters' eyes. So that was a lot, but that's my response to where we can start individually, and then how we can move forward collectively to begin that healing.
Thank you so much, Dr. Shaw. That was very deep, and we really appreciate your perspective on that.
Thank you
so much. So I'm going to go ahead and bring Tammy on so we can engage our audience, because I know that they do have some questions for our panelists. So Tammy?
Sure, I'm right here. So awesome conversation so far. I'm literally like snap, 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 whoop, whoop, whoop. Oh my God, so excited for the work that Representative Fentress is doing to represent her constituents. And thank you so much for all the work that you're doing to serve us and serve the community. And thank you so much, Dr. Sharon, for really talking about what are some ways that TBHC is really fostering collaboration and how we can make change. So thank you, thank you, thank you. So we did get a question from Rodolfo Cortez from YouTube. His question for the panel, so anyone can answer this question, is what can be done to normalize a negative stigma that comes with seeking therapeutic health? So who wants to take on that question? And please post your questions on YouTube and Facebook. We want to see your questions, but who wants to take that on? What can we do to deal with the negative stigma of asking for mental health help?
Tammy, I'll chime in.
Definitely, please.
So first, I just think we need to talk about it. We need our leaders and the people in our community who people look up to start talking about mental health. And I honestly think people do not know what mental health issues look like. The best way to reduce the stigma is to have our leaders, our role models start talking about it, sharing experiences. Pastors, athletes, mothers, fathers, cousins. We talk to our cousins a lot. We need to share our stories. Just from preparing for this panel discussion today, I even found out one of my cousins is being seen by a mental health professional. And then he started sharing with me some things that he had been going through. And he was talking about being a product of an environment. He gave me some studies to read because he was in the military. So that attributed to some of his mental health issues. But he also said his childhood, and I was like shocked. So he just shared with me some things about mental health. And just that one talk led me to think, hey, maybe I need to go see a counselor too sometimes, because I am one of those people that think I can deal with whatever comes to me, and we think that, we can do it ourselves. But sometimes we just need to know that we're not the only people going through some things, and there's people out there to help.
I would just add too that, we go to professionals for everything else, right? Like, fellas, if you're looking to get that fade and you want it just right, like, you're not going to come to me to cut your hair. I don't know how to do it. I'll offer to do it, but it's not going to look right. You're not, ladies, you know how we are particular about things. And so we go to professionals and seek help for each and every other thing that we need in our lives, right? So this should be no different. And there certainly is value in speaking to friends, in going to church, in seeking out faith, seeking out God in your heart. There's value to those things. And I would just suggest that it doesn't have to be an either or proposition. But, our friends are not really trained, unless they are mental health counselors, they're not trained to deal with these issues. People have their own issues that they have to deal with. And so I think we have to start thinking about this as any other service we would seek out a professional for, and then pursue that.
May I add to that? Because I actually had this conversation earlier. I think with the faith-based communities, I remember speaking to a pastor once who he admitted that he used to say, oh no, our faith is enough, we can pray about it and it'll be okay. And he's now realizing, oh wait, I'm not equipped. Like I need help, I need resources. So that's good that he thinks like that, but there's still other faith-based leaders who may not have arrived at that place. And I wonder, is it about, and I'm always going to be talking about bringing people together, right? It's the Tampa Bay Healthcare Collaborative, but I wonder if it's about bringing faith-based leaders together and having that conversation with them and getting them to a place where they're comfortable with sharing with their flock, because people listen to their pastors, So that was something that came up in a conversation. And I think maybe that's one way to go, is start with bringing the pastors together so that they're comfortable with having that conversation.
I agree with that. And also too, I do see more conversations about mental health on social media. Even TikTok having more therapists making videos and normalizing therapy, also normalizing, mental health issues, putting out that they have their own issues and traumas that they're dealing with or that they've dealt with. So normalizing therapy all around on social media platforms, as well as through churches and schools and, wherever, helps with removing that negative stigma that mental health is for crazy people, or going to therapist is for, if you're crazy, or if you're collecting a check, or if you have the means for it and it's a luxury, it's a white people thing that only those who are well off and who are privileged have access to mental health. So I think those things will help to normalize going to a therapist, seeking help through a psychiatrist.
And I agree with everything that's been said. I think one of the things that I would add to that is experience. We just need to try it. We wouldn't know if we liked ice cream if we never tried it. We wouldn't know if we liked, a pair of shoes or a pair of pants if we never tried them on. So as much as we're talking about, it's so important for us to go and we seek professionals for certain support, but it's also so important for us to just kind of keep that open mind to, let me just go and try. And one of the things that I always say is try out 3, because not all therapists are equipped or are a good fit for every person that walks through the door. So it's very personalized in what approach you need in order to receive that support that you're looking for. And one of the last things I'll say about that is kind of removing that concept of weakness. That's oftentimes what I see at Enzo and within my practice is, first we have to help people understand when they come to therapy or they come and see one of my coaches, really, I see them just to have a conversation. There's no aspect of, okay, there's something wrong, and therefore because there's something wrong, you have to come in. It can be simply, I just need a place to go. I need a neutral soundboard to share what's going on in my world. My judges, my lawyers, my physicians, my anesthesiologists, those are the things that they just need a place. My CEOs, they need a place to be able to say what's going on in their world that is confidential, and that it might not be problem-based. It might just simply be, I just need to dump, and I need to be able to have someone else give me a perspective. So kind of shifting why we go to therapy in our minds is going to be the best way to be able to break that stigma.
Yeah, thank you so much for sharing that, because I think that is a huge barrier that Diana talked about in the beginning, is that stigma or that fear of we don't tell people. It's kind of like hiding something in our purse. We don't want to tell people that, that we're seeing a mental health therapist because we're afraid of the stigma or our reputation. So I think it's good that we do need to kind of what Representative Fentress talked about, the education and the awareness. So there was another question that came up that is actually a great question because it's alluding to what we're going to ask Dr. Shamika is Cal Jackson asked a question that comes up a lot in conversations as we talk about the state of mental health in the Black community is there a directory of Black therapists that we can vet and also determine which insurance providers they accept? And this question is a key one because, especially what we were talking about earlier, if I'm a Black woman or a Black male, I may want to have a Black therapist because of the cultural pieces or some of the cultural implications of having that relationship or that kind of like experience is what I was trying to say. So again, is there a directory of Black therapists that we can vet and determine what insurance providers they accept? Thank you, Cal, so much for that question.
I can answer. I don't know if you can. Sorry. So, was that a question for anyone?
Yep, it's open to anyone. Yep.
Okay. Yes, there actually is. There are several resources. Several directories. One directory that I am part of is Therapy for Black Girls, and you can go on there and look, and it's basically a directory for therapists of color. There's also one that is starting up. It's for clinicians of color. And you can you'll be able to go on there and look for therapists in your area. And you will know that, that they are, therapists of color. The other directories, there is a directory, Psychology Today, that is very popular that most do put their information on there, and you are able to see pictures of the therapist, and so you're able to contact them. And I always tell anyone who's seeking therapy or even a client or someone who calls you can vet a potential therapist. You ask them questions. If you're concerned about whether or not they're culturally competent, ask them. Don't be afraid to ask your potential therapist questions about their views, and so that you can see if they align with yours, if that is someone that you actually want to do some trauma work with, or whatever type of work you're trying to get accomplished in therapy.
And I'll piggyback off of what Diana's saying. Yeah. A lot of those directories will also include what insurance panels they're on, which will be able to make it a lot easier for the potential client that's looking for that relief and that support to know if that's in alignment with them. And one of the things that I'll mention just quickly with that is what Representative Fentress said is about the reimbursement rates. So that's the other part to kind of pay attention to, is that there's a lot of qualified clinicians, and I think myself included, that won't be a part of certain insurance panels simply because the reimbursement rate is insulting. I'll be perfectly honest with it. It's insulting to our level of education. It's insulting to our level of skill because, it's being paid pennies on a dollar, which again goes to that disparity of why is there not enough representation? Why are they not qualified? Because that's the thing that you said, Cal, is can we vet them? There's a lot of clinicians out there, and not all of them are qualified. Not all of them, like I said earlier, are equal and the same. And that's the thing that you'll also see when you have insurance panels, is that there are some where people will absolutely refuse to be a part of simply because of that reimbursement rate, which does a detriment to our community.
Right.
Yeah, thank you so much for sharing that. And I think this is so thank you, Cal, for that question. I think this is a really good segue into the next question for Dr. Shamika around how can we make therapy more accessible and affordable? And what is the role of, for insurance providers like Florida Blue in making this available? So if you can share more about some of the work that Florida Blue is doing to address the accessibility piece.
Well, thank you, Tammy, first for inviting Florida Blue to be a part of this conversation. And I want to thank our market president, Dave Pizzo, and his team for reaching out to me to be a part of this important discussion. Florida Blue, we really understand the important role mental health plays. We cannot achieve good physical health without also having good mental health. We always talk about mind, body, and soul. Think about it. The mind, that's the soul, and the soul. And we have to focus on mental health. This is really, really big in all the communities, especially the Black community. To demonstrate our commitment, earlier this month, we announced that our parent company, which is GuideWell Health, we acquired the majority stake of New Directions Behavioral Health. They actually manage our behavioral health access for our members. And that investment was to ensure that we were driving growth in new areas and innovating the behavioral health, innovating that it is delivered with a more integrated health model approach. So integration of behavioral health into management of our overall health is very essential. So we're doing some things a little bit differently to make access easier and more affordable.
Thank you so much for that. And just as a quick follow-up too around, and I know we kind of alluded to this earlier, what are some ways are you expanding your network to make it easier to access Black mental health therapists? What are some ways can we resolve that gap?
Well, Florida Blue, we actually have a really, really good coverage across the state. And we've also started offering our services virtually. We're in the process of deploying digital solutions that are consumer facing, especially in this climate. And we're not trying to get rid of the face-to-face, but we just have to be safe right now for our members. And that's priority. We have over 5,000 behavioral health providers that contract with us. And we understand that African Americans may have a preference for African American provider. And we're continuing to do journey work to make sure that Florida Blue have the right providers in our network. So we're still determining ways to make sure we get the members to access to the Black mental health professionals. I did want to also add, when we talked about affordability, right now we have waived our copays for those virtual behavioral health visits. We're doing that this year, and we built it into our plans for next year. And also from employee benefits perspective, we all need to remember, not just Florida Blue, but most companies offer those employee assistance programs. I know they call them EAP. These are voluntary programs offered to our employees, free confidential assessments, short-term counseling, referrals, and follow-up services, therefore our employees for their personal and work-related problems.
Could I chime in on that?
Yes.
Sure. Thank you.
First of all, thank you for sharing that information. And I love it when business is not afraid to take the lead and blaze a path when government is slow to act. So I'm very glad to hear that Florida Blue is doing these things. I will say that the legislature has made some moves and enacted some policies to expand the availability or just how far telehealth can go. So I'm very excited though to hear all about that. With the employment assistance programs, I wanted to also flag it. It's not just companies, but actually, if you work for the state government or a county government, if you work for a governmental entity, you should also have access to the employee assistance programs. I mean, oftentimes they'll allow, I think, up to 6 sessions they'll pay for. So it's a really great benefit, and I imagine that it's underutilized because not a lot of people know about it. And then I was thinking too, for people who don't have insurance, what can they do? There are a number of apps online. And when you reference telehealth, that made me think of this. Apps like BetterHealth, where you can go on and get connected to a counselor and get the help that you need. So.
Can I chime in on that as well?
Sure.
Okay, so that was Representative Fincher's talking, right? So some other things that I have seen some therapists do, and myself I have done in terms of having access to therapy, or at least affordable therapy. There are some therapists that are offering sliding scale for those who do qualify, who are having, financial difficulties, or, who are on that poverty guideline. There's sliding scales. There's also reduced rates. There are also you can get you can get access to therapy. There are some therapists that are registered mental health counselors. They're not licensed, but they're in the process of being licensed. They've already did all their education, and they're just doing their postgraduate internship. And they do work alongside with licensed therapists, and they offer therapy at a reduced rate. Like myself, I have a registered mental health intern that is working with me, and I am able to provide low-cost therapy for clients that do meet those qualifications. Some therapists, and I don't know, I'm not too sure if there's a resource for this, but there are some therapists who may offer pro bono therapy where it's, a set amount of sessions. I'm able to actually have a limited amount of spacing for pro bono work that I do offer to some of my clients, depending on the situation. So that is some things that I have found that some therapists have been doing across the board, alongside with accepting EAP and having the virtual therapy, having telehealth, where, insurance companies are waiving the co-pays for that. So those are some things that I've been seeing happening, since we're definitely needing more mental health services.
Yeah, definitely. Thank you for that. And one thing I wanted to share, and I thank you both so much for kind of sharing, like, if someone does not have insurance, what resources are available to them. And Tampa Bay Spark, we actually posted on our social media. If you follow us on Instagram or Facebook or LinkedIn, we posted some resources that are extremely compelling and phenomenal. I know in Pinellas County, there's this You Good program that I saw, where the number has been posted. It is for Pinellas County, the Community Foundation of Tampa Bay. I know you all posted in partnership with Leap Network and Humana have also shared an initiative that they're working on to address mental health. So there are a lot of resources out there. And for those of you who asked a question about where can I find a Black mental health therapist, we also posted, just highlighted some mental health, some therapists as well. So definitely follow us on social media. We did share some resources that you can access. But thank you so much for sharing that. It's very, very important. Yeah, please.
You asked me earlier too, what resources that Florida Blue had available for the Black community to access mental health. And I just also wanted to share that when the pandemic started, we immediately launched a toll-free 24/7 bilingual emotional support helpline for all Floridians, regardless of if they were Florida Blue or not. I can provide that number. We still have that available. And like I said earlier, we waived our co-pays for virtual behavioral health visits at our Florida Blue centers. So the standalone Florida Blue centers that you see in the Tampa Bay area, we have integrated social workers. We call them community specialists. So they're in our Florida Blue centers across the state, and they provide no cost one-on-one support and guidance. And that's not only to our members, but anyone in the community. So I wanted to add that piece as well.
Absolutely phenomenal. Thank you so much, Florida Blue, for filling the gap. Absolutely phenomenal. So I'm actually going to jump to you, Angie. The next question is really focused on, there's a lot, this year has been tough. We all know that. It's been very, very difficult. And in the Black community, we constantly see images of police brutality, protest, and, we just came off an election. There's been so much kind of like implanted into our psyche, from television to workplace discrimination to personal struggles. There seems to be so much getting in the way of pursuing positive mental health outcomes for ourselves. And there are people who may not necessarily know when to reach out, for mental health support. So the question that I have for you is, what are the signs that may indicate that it's time to schedule an appointment with you, right? Or with Diana, like, when is it time? When would you say it's time?
Always. I think that really that, again, we kind of answered some of this question a little bit earlier of what are we looking for whenever we end up just making that decision to come to see a therapist? And as far as I'm concerned, and especially with a lot of the clients that come to see me, we don't need to wait until we're at a tipping point. And that's the time where it feels like our hair is on fire and everything is really just kind of falling apart. I say come well before. Have that opportunity to talk and to share with someone just the things that are going on with life. Because once our hair is on fire, it's easier for us to practice those coping skills when we're not in crisis. And then we can easily, almost like a reflex, implement them when we are. So anytime, at all times, is the perfect opportunity for us to come and seek a therapist and to seek coaching or anything else like that, is to feel that support. Because again, if a clinician's role is for us to be a mirror. We point out some of those things that other people might not be able to see. We personally can't see ourselves. So just like if I were to try to put makeup on without a mirror, I would end up looking like a clown. And that's one of the things that we do. We walk around life kind of looking like a clown if we don't have that reflection. And sometimes, family and the spiritual world and churches and the religious community, they can be that reflection, but sometimes it's not as crystal clear as what a therapist would provide to us. So anytime is my answer.
Love that. Love that. It's we don't just wait until a crisis, right? And it's interesting because, treating, our mental health we should treat it the same way as our physical health. Like we'll have an annual next week. I'm doing that to be proactive. It's the same thing with our mental health. We can also be proactive about our mental health by reaching out to the therapist and making sure that we're stable emotionally. And so the follow-up question that I actually have for that is, what healing practices do you believe are critical to holding ourselves accountable to growing and healing and really improving our mental wellness? What can we do individually, would you say?
I actually am going to reference what Dr. Sharon said. I loved the analogy of what it takes in order to create healing, especially within a flesh wound, and all of those just different systems that come into place. To me, one of the things that we're doing at Enzo and one of our biggest pushes within the rest of this year as well as next year is to connect with corporations. I love EAPs. I'm a part of a lot of EAPs. I also have 4 different registered mental health counseling interns to provide that affordable care. But for us, we really see it as contracting directly with companies in order for us to be, at Enzo, to be their primary providers as an agency. For example, we have a nurse practitioner, we have an internal medicine doctor, we have 4 clinicians, we have 3 life coaches, we have a Reiki healer, we have a massage therapist. So as an agency, Enzo Behavioral Health Care, really, we are trying to be that one-stop shop for companies to connect with in order to get all of those multi-layers of healing. It's important for the individual to get that healing in order to, like Dr. Sharon said, and everybody on the panel has already mentioned, is that if I'm walking around life blindly, hurt can kind of spread. And that's the thing, is if I'm able to start seeing where my character defects are, where my wounds are, where my blemishes are, and I start coming to a place of acceptance and healing with them and learning different ways of coping in life. So we're not just reacting to things, but we're learning how to respond in a healthy and productive manner. That's the best way to start finding all of that healing that we really need to. And especially when we integrate your companies, now we're able to do it on a multi-level area where we're able to directly address your leadership. And with your leadership, we're able to say, hey, here are the concerns within this corporation's health, so that now we can help influence the individual's health, and that individual can help their family's health. So this is the multi kind of tiered healing process that we really need to look at, because we all know that we spend the most time with our corporate friends and families. So it's best for us to be able to receive that healing in our corporations as well as individually.
Absolutely love that. And I love how you talked about just this domino effect, right? Like when we ourselves individually are healed and whole, it not just affects us, but it affects everyone around us. We're able to have healthier relationships. We're able to really pour into others when we ourselves are filled. And I absolutely love that. We're not just doing this for ourselves, y'all. We're doing it because of, as all the panelists mentioned, it's about that collective healing, but we ourselves must be healed first. This is something I've learned the hard way, right? But it's very important. We did have a quick technical question, if anybody wants to answer, is what does EAP stand for? And what is EAP, if anybody wants to answer that question?
I can answer that one. It's Employee Assistance Program. I know that Dr. Shamika and Frentrice also mentioned this, where it's an employee assistance program, and it's not just for the individual through a corporation, but it also includes a certain identifiable number of sessions with their families too. So you can have that individually, or you can also elect to have EAPs depending on your company's contract with the insurance provider. You can also elect to have sessions for your family members with that contracted clinician.
Awesome. Thank you for that. And so I do have an audience question. Another one here is, what do you look for in a therapist? So if you want to just post that on the comments, and I'm actually going to open this up to our panel, is, what should people look for in a therapist? Like, what is a therapist? What is not a therapist? And what are some of the distinctions that people should really make? And again, everyone, just post your comment, and also post your questions. We want to make sure we hear your questions and have the panelists answer those questions for us tonight too. But for the panelists, what should people look for in a therapist? Like, what is realistic? What is kind of like not necessarily realistic? Or what are your thoughts about that?
I can go first. I know a lot of the things that my clients say to me about what they appreciate with me as a clinician is that I'm real. You're not going to get all the textbook answers. You're not going to get something that is disconnected. You're going to get me connecting heart to heart with the person that's sitting across from me. I would look for someone also that is non-judgmental. If you feel like your therapist is critical or judgy or anything like that, like that is kind of something to just push pause, evaluate, is this my perception or is this what's happening? And if you feel discomfort, find someone else. I know a lot of the times people really are looking for someone to listen to them. Beyond anything, listening and hearing the other person is so absolutely necessary. One of the things that I do that is, I think, maybe different, I don't know, Diana might be able to help me with this one, is I'm in it. Like, I am a part of the journey with someone. I am absolutely going to also show that reflection and hold people accountable for their stuff. If we're working on something coping wise and we're encouraging to try something different and they don't do it, then I'm going to address that. I'm the person that's going to call you on your behavior and call you on your stuff, because if I don't, I'm just a friend, and you don't need to pay me my rates to talk to a friend. I'm here to help you actually move through.
I'd like to add to that as the therapists continue to answer the question, because I'm also, as Tammy shared in the introduction, a coach, a spiritual, transformational, and wellness coach, right? And so I've heard people say to me, when they ask me what is a coach and I describe for them, then they'll say, well, what's the difference between you and a therapist? And I'm like, there's a big difference, because you're not going to sue me. Right? A coach is someone who helps you think about your thinking and walk through your journey as you arrive at your solutions. I've had clients who are paying me as a coach who also has a therapist. So I just want to be clear that coaches and therapists are different. They serve their roles. It's okay to have both, but don't mistake your coach, if you have one or want to get one, for your therapist. And so I'm gonna leave it there and let the therapist continue to define what that looks like.
And I want to interject from a insurance carrier perspective, because we want our members to stay healthy. And that's way more cost effective than being sick, right? So one of the things we tend to do as African Americans, We tend to look for a mental health professional that looks like us, because we feel that person can relate to us better and understand what we're going through. And while that is true, if you're trying to go to someone that's covered on your plan, please rethink this. Just think about it. When you have a special condition that you need to see a doctor for, or see a specialist, you start looking for the best doctor around, no matter what their color is, right? So just use that strategy when seeking a mental health specialist. They are trained mental health professionals, and no matter the color, a trained mental health professional can help you. So we would rather you be see a trained mental health professional than not see anyone. So I just want to say that.
If I can chime in a little bit of some things. So another difference between a coach and a therapist is the fact that a therapist is licensed to diagnose. So one of the things that I do share with my clients is that, especially because I coach and I do therapy as well. So the big difference that I always tell them is that if you're needing a diagnosis, if you're experiencing mental health issues that are needing psychiatric care and all that, you need to see a therapist. A coach cannot coach you through hallucinations. That's not. So that is a very big difference between a coach and a therapist, is the fact that a therapist is licensed to diagnose and work with you through those different types of therapeutic needs. That doesn't just require like a life change or, walking through transitional changes. So one of the things that I do always recommend some of my friends or whomever, when they're looking for a therapist, what to look for in a therapist is to find someone that you vibe with. Although I do absolutely agree that, you want to get the best care as possible, you also do want to make sure that you're comfortable with your therapist. Because if you're not comfortable with your therapist, you're going to go into therapy and you're going to sit there for years upon years getting help, but not really getting help, not really going or working through the issues working through your trauma that actually needs to be worked on. But because your comfort level isn't there, you shy away from sharing that part of you. I think the biggest thing about this year for me, one of the things that opened my eyes, is the fact that representation does matter. It actually does matter to a lot of my clients that I am a Black therapist. They purposefully seek me out because they need that representation. They need to sit across from someone that they can tell their story to and not have to worry about any type of fragility, not have to worry about hurting someone's feelings or having to question whether or not they should say these sentences, or having to code switch, having to explain. Like I have a client who started speaking patois in the middle of our session, and I didn't have a clue of what she was saying, but I understood because I'm Haitian and she's Jamaican, but I was going right along and I'm like, yes, absolutely. I get exactly what you're saying. And she was able to continue to have this conversation with me. She was able to be her true, authentic self without having to put on her customer service voice, not having to worry about, is she saying the right thing? Will she be judged? And so I think that is what you look for when you're looking for a therapist, because I have a white therapist myself, but I've been with her for such a long time. She knows all about me. However, if I was to go get a therapist today, I would look for someone that I can speak to about the racial trauma that's happening right now. Honestly, I need to talk to someone about how I feel in the professional realm, because I just don't feel comfortable and I need a safe space to release. And I think that's what you need when you go into therapy. You need to be able to exhale, and you need that safe space. And that, for me, I make sure that that's what I am, whether it's virtually or in an office space. I'm that 50-minute of session that you can just be without having to worry. So that's what I strongly believe you look for when you're looking for a therapist.
Oh, Angie, I thought you said you wanted to add something. Did I see you raise your hand?
I did,
Okay.
but I was like, Diane, got this. Okay. Seriously. I mean, I think the only other thing I would add to it is experience and training. That's the biggest, another one of the differences is within my master's level training, one of the things that we were required to do is do 10 sessions with a clinician. And my now current clinician or therapist is a Puerto Rican woman. And we worked on over 13 years ago, my racial trauma before a lot of, even before some of this stuff even happened within this year of kind of like pulling it to the forefront. So that was one of the works that I did first and foremost with just myself personally, of looking at like, she asked me this question. She says, when was the first time you knew you were Black? And I was instantly recoiled and got very upset and frustrated. And I was kind of like, how would you ask me this question? Like, what are you talking about? And it really opened the door for so much more self-understanding, self-awareness of how I navigate the world, and really looking at that. So I would say like training is really a priority of whether you're or not your clinician or your coach, because I'm not going to discount them within their level of skill, talent, and empathy, but how much training do they have? How much experience do they have? And absolutely, it's all about the vibe. When you talk to them, I don't want to have to over-explain something to someone, which is why I loved my clinician asking me that question. And it really helped me to really unpack a lot of my stuff, and to then be able to, now I love it whenever I'm able to sit across the sofa with someone, of being able to say to them, yep, I know exactly what you're talking about.
Mm-hmm.
I went through and I did the work.
I absolutely love this conversation because you all kind of answered this question already about the importance of seeking mental health therapy cannot be underscored, right? So I want to bring it from an individual back to the system level as we prepare to close. This such an amazing conversation tonight. It's been healing for me. I just feel just so good right now listening to you all speak. But the question I have is, what do we stand to lose as a society if we don't continue to invest time and resources to positively impact the mental health care outcomes in our communities? Like, what do we all stand to lose collectively?
Is this an everyone question?
Yes, it is. Yeah.
Okay.
Yes, it is. Yep.
Well, I'll come from, okay, so I'll come from a perspective as a therapist that works with children. As stated earlier, I work with kids as early as 3 years old. And I strongly believe that our kids need to understand the importance of working through their mental health. Too often, I see parents neglect our children because and I'll say we because I'm a parent too, we often kind of push aside how they feel, and we then seek assistance for ourselves, but then we don't try to get assistance for our kids. And it's a lot easier to work with the traumas of a 3, 4, 5-year-old than to work with an adult that has years of trauma, years of packed on whatever, grief, loss, whatever, that they've never worked on, because as kids, they never went through anything, no social skills, no type of self-esteem, anything. And then you have adults walking around with these bags of trauma. They're emotionally unhealthy. And then we have what we have today because we didn't tend to their mental health. So I think we do need to start with children, because that's where we're teaching them to be emotionally healthy, to erase that stigma that therapy is for crazy people or privileged. I have a lot of kids who are very excited about going to therapy, that they're sharing it with the world. And you're like, can you not tell everybody I'm your therapist? Can you not? Or they'll see me at the store and they'll run, oh, it's Miss Diana, that's my therapist. Okay, it's supposed to be a secret. But they're really excited about being in therapy, and they're working on their mental health. And so I do believe that in working with children, that's where we could start. That's where we need to start.
And one of the things that she did say that was very important is timing, right? So one of the last things I want to stress is you don't have to have a serious problem like depression, anxiety, or addiction to get help. We as African Americans, we have a tendency to seek help when it's too late, like once a problem has become out of control or debilitating. And unfortunately, it's harder to address once it becomes that serious. So I really want to stress, if you feel like you may need help, get help. I just cannot stress that enough. Plus, when you talk about what can we lose, we have the potential as a society to lose our brothers, our sisters, our uncles, our cousins, our family. Think about it. Historically, mental health therapy was associated with mental institutions, right? So we don't want to get mental help, right? So, but Black people, we are disproportionately put away in those long-term mental health facilities and institutionalized. And I would be wrong if I did not acknowledge that this is a very real concern. We represent less than 15% of the United States population, but closer to 25% of us are in those long-term institutions. So we are overrepresented in mental health facilities. And in many ways, this is because of misdiagnosis, not being treated, lack of resources, delayed efforts to get help. So timing is very important so that we can receive the appropriate diagnosis and seek help before we're in a crisis state.
I want to add to that, but not really add. It's more like a question in your question, Tammy. So I agree. We stand to lose our lives, our families, our communities. Like, yes, absolutely. I've lost family members. Yes, I'll leave it at that. I've lost family members. So I'm wondering, though, going back to an earlier question about what can we do to normalize getting help. Just like there are many of us, maybe not everyone, so we still have work to do with that. But there are many of us who know we're going to go in for our annual doctor visits, our biannual dental visits. Maybe this question is for the therapist or for Dr. Jones, but how do we get people? Is it a good idea to make that an annual checkup as well, yes, right? And then is there a way to pack it in to make people know, like, oh, I'm making all my doctor's appointments for the year. That's a part of the appointments that I make as well.
Mental health maintenance check.
Yep. This is why I love this panel, because I think that everybody has at Spark created such connections to be able to really look at how the system is impacted. And my perspective within your question, Dr. Sharon, is like, if for me at End Zone, again, I go back to what our mission is. If we can connect with your company, if we can connect to the places that you work, and through that do kind of marketing, advertising, normalizing services, let that then be something that in insurance panels that they work with, if their insurance company doesn't utilize either direct care providers or doesn't utilize those EAP services that are providing positive reimbursement rates for those clinicians, then that's kind of the key, is to really sandwich it all together so that we're all being able to encourage that mental wellness maintenance plans, or those checkups, or those check-ins. So I really think, just to answer that question, and I'd like to answer the big one, is if we touch on mental health and we make sure we're continuing to market those services and those benefits of the services in all areas of our lives, I think that can create that positive change. And to answer the question, what do we stand to lose? To me, what's happening right now is fear. We are in a state of intense, heightened, chronic fear. And as a society and as individuals, we tend to not know how to handle fear. What do? We tend to fix, manage, and control. How can I control my environment? How can I control the people around me? How can I manage my environment? How can I manage myself and the people around me? And that tends to be very reactionary and counterintuitive or counterproductive to us as a society. Because like you mentioned earlier, there are silos, there are separations that occur. There's then looking at people as if they are the boogeyman because of all of that fear that we have and that we're kind of sitting in. What we stand to gain when we address fear and we learn how to address fear in a healthy way is connections, is healing, is happiness, is empowerment, like we're doing right now, is really seeing the change that we all are on this panel and everybody that's watching is really looking and waiting and hungry for. If we learn how to address fear, in my opinion, we as a society and as a community can become unstoppable. Because fear is always going to be there, but that's the thing, thank you. That's the thing that ends up getting us tripped up. That's the thing that stops us. Why do I not apply to that job? I'm afraid. Why do I not go and ask that person out for a date? I'm afraid. Why do I not, talk to my representatives and encourage them to support us? I'm afraid of what they might say. Are they going to reject me? Are they going to not understand me? This panel serves this purpose of really breaking through that fear and showing everybody here is open to and having those conversations to then shift our perspective of fear.
And I just want to add, Dr. Sharon, that was a great question. Because what can insurance companies do? And I know that some of our plans, we offer incentives for doing those wellness checks and sometimes give people some incentives such as money back or things like that. So you have me going back to check to see if for mental health services, can some of our members qualify for those incentives based on seeing those type of providers? I'm probably going to go back and double check, and if not, make a suggestion, because we do have that for other healthcare services, like you said. But if we want to impact or have our members check on their mental health as well, we should look into that as well.
Mm-hmm.
Awesome. Thank you all so much for answering that question. Representative Fentress, Dana, did you want to chime in on that question? What do we stand to lose as a society as we close?
I did. And thank you. This discussion has been so just wonderful. And I wanted to share some information that's on the U.S. Department of Health and Human Services Office of Minority Health website. It says poverty level affects mental health status. African Americans living below the poverty level as compared to those over twice the poverty level are twice as likely to report psychological distress. In 2017, suicide was the leading cause of death for African Americans aged 15 to 24. The death rate from suicide for African American men was more than 4 times greater than that for African American women in 2017. So I wanted to bring that into the conversation because, what do we stand to lose? We do. We stand to potentially lose out on the untapped potential of generations, right? And we stand to lose. I mean, it's been said tonight, but we stand to lose our ability to reach that potential. We stand to lose lives. It's critical. And I know that we are a panel full of women tonight. I really hope that the brothers were able to get something out of it as well, because this is an issue that's important to them too. And it's a conversation that must be continued. And so I just thank you, Tammy, for all that you are doing. And, please continue this conversation.
Awesome. And thank you all so much. We could have covered even more. This topic is huge, everyone. I know that there are so many aspects we could have covered tonight. and to really address, the holistic, comprehensive, multidimensional issue of the state of mental health in the Black community. But you all did such a phenomenal job of really, really helping us understand what community leaders can do and what we all can do individually to really contribute to our individual healing, but also the collective healing. So there's more conversations to be had. This is not the end of this conversation. So as we close tonight, we just want to thank, so those of you who are watching on YouTube and on Facebook, if you could give our panelists just kind of like a virtual round of applause so much for sharing their wisdom tonight. I hope that you all left with tools. I hope you also felt empowered to really take control of your own individual healing. And one thing we really want to emphasize too is, don't be afraid to advocate for yourself and advocate for others as well. And let's all educate one another, and let's all break down that negative stigma. If someone says they want to seek a therapist, affirm them. If someone comes up to you and says, you know what, I really want to see a therapist, affirm them in that decision. Let's affirm one another. Let's look at mental health and healing as the cool thing to do, the cool thing to rock, right? So please, please, please follow our amazing speakers. We're posting their information on the page right here. So follow Dr. Sharon and the work that she's doing with the Tampa Bay Healthcare Collaborative and her coaching. Follow Dr. Shamika Jones and Florida Blue and the work that they are doing to really help close the gap in the mental health community, or in mental health. Follow Angie and Enso Cares and the work that they're doing. Really phenomenal work. They're closing the gap and providing services for healing. Follow Diana. Follow the work that she's also doing as well to really help provide healing for our communities. And definitely, most certainly follow Representative Fentress and her amazing team and the work that she's doing to represent us all, to provide healing to the community. And follow us at Tampa Bay Spark. We will be following up with resources and tools that you all can. So if you forgot, like what did Florida Blue talk about? What was going on? Don't worry, we will follow up with an email about all of the great resources that are available to you and your family and your loved ones to really help support your mental health outcomes and those around you. Thank you all so much for joining us tonight. Thank you to, again, our amazing panelists. Everyone, have a great Thanksgiving next week. Have a great holiday season. Take care of yourself. Choose peace over everything else, and much love. Thank you all so much. Have a great evening. Thank you for joining us this evening.